Watching this presidential debate, boy. They getting it for real.
Right now, you can actually take a deduction for moving a plant overseas.
Romney don't like it, yo. I swear he don't.
Americans would say,
and they like, yo, he don't like it because Obama is black and he's speaking educated.
Allows us to do
America don't like a black educated man.
To help young people, the way we already had during my administration, make sure that they can afford to go to college. It means that the teacher that I met in Las Vegas,
view upon it, like,
wonderful young lady,
Romney wants to,
who describes to me,
because I'm actually listening. I'm not just watching just because the election's happening. Let's go watch this. Nah, that's pointless. Get your life straight.
Until
it's fucking pointless. Listen if you don't watch
textbooks that are 10 years old.
Obama's talking about tax ads plus revenue, so things can balance out. Romney's only talking about tax ads and cuts.
And if we're asking for no revenue,
he's talking about adding jobs, but at the end of the day, you add more jobs. The government pays these people for their jobs they do most of the time. I mean, y'all getting slight money from other sources, but where is the money going to really come from? Unless people are giving money that already have it in America. That's just how I feel about it.
We're talking about potentially a 30% cut in Medicaid over time.
Everybody want to sit here and blame Obama, like, nigga, y'all fuck shit up for Obamacare. Don't blame that shit on that man. Fuck y'all. I'm on Republican, voting for Nick Trump. Fuck you, bitch. Dumb hoe.
Autistic kid and is depending on
swag jacket too.
Medicaid. That's a big problem. And governors are creative. There's no doubt about it. But they're not creative enough to make up for 30% of revenue on something like Medicaid. What ends up happening is some people end up not getting help.
Jim, we've gone a lot of topics there, and so it's going to take a minute to go from Medicaid to schools.
What all has Obama do? Add everything he did and subtract everything he didn't do. Do that. And then you talk shit about Obama.
Companies is $2.8 billion
fucking
a year.
Up the economy.
And it's actually an accounting treatment, as you know, that's been in place for 100 years. Now,
it's time to end it.
And in 1 year, you provided $90 billion in breaks to the green energy world. Now, I like green energy as well, but that's about 50 years worth of what oil and gas receives. And you say Exxon and Mobil, actually this $2.8 billion goes largely to small companies, to drilling operators and so forth. But you know, if we get that tax rate from 35% down to 25%, well, that $2.8 billion is on the table. Of course it's on the table. That's probably not going to survive if you get that rate down to 25%. But don't forget, you put
that nigga adding fake ass numbers and he's saying it's so good that it really does sound good. I give him that.
Into solar and kudos. To Solyndra and Fisker and Tesla and Enter1. I mean, I had a friend who said you don't just pick the winners and losers, you pick the losers. All right. So this is not the kind of policy you want to have.
That nigga look like Bison from Street Fighter.
The second topic, which is you said you get a deduction for taking a plant overseas. Look, I've been in business for 25 years. I have no idea what you're talking about. I maybe need to get a new accountant. But the idea that you get a break for shipping jobs overseas is simply not the case. What we do have right now is a setting where I'd like to bring money from overseas back to this country. And finally, Medicaid to states, I'm not quite sure where that came in.
Fucking with America?
Which is, I would like to take
overseas. Ain't nobody fucking with America.
And say to a state, you're going to get what you got last year, plus inflation, plus 1%. And then you're going to manage your care for your poor in the way you think best. And I remember as a governor, when this idea was floated by Tommy Thompson, the governors, Republican and Democrats, said, please let's do that. We can care for our own poor in so much better and more effective a way than having the federal government tell us how to care for our poor. So let's states. One of the magnificent things about this country is the whole idea that states are the laboratories of democracy. Don't have the federal government tell everybody what kind of training programs they have to have and what kind of Medicaid they have to have. Let states do this. And by the way, if the states get
so how you gonna tell people how democracy works and you're a fucking Republican?
The right approach is one of
what the fuck?
The brilliance of our people.
Don't tell people what. Shut up.
Going on still on the economy.
Shut up. How you gonna tell a nigga how to eat some chicken? And you're a white person.
This is segment
Shut up.
The economy. Entitlements.
Oh, no.
First answer goes to you. 2 minutes, Mr. President. Do you see a major difference between the two of you on Social Security?
You know, I suspect that on Social Security we've got a somewhat similar position. Social Security is structurally sound. It's going to have to be tweaked the way it was by Ronald Reagan and Democratic Speaker Tip O'Neill. But The basic structure is sound. But I want to talk about the values behind Social Security and Medicare. And then talk about Medicare, because that's the big driver of our deficits right now. You know, my grandmother, some of you know, helped to raise me. My grandparents did. My grandfather died a while back. My grandmother died 3 days before I was elected president. And she was fiercely independent. She worked her way up, only had a high school education, started as a secretary, ended up being the vice president of a local bank. And she ended up living alone by choice.
From nothing to something.
And the reason she could be independent.
That's what she gonna do. From nothing to something. Watch.
She had worked all her life, put in this money,
I ain't watching the throne of
understood that there was a basic guarantee, a floor under which she could not go. And that's the perspective I bring when I think about what's called entitlements. You know, the name itself implies some sense of dependency on the part of these folks. These are folks who've worked hard, like my grandmother, and there are millions of people out there who are counting on this. So my approach is to say, how do we strengthen the system over the long term? And in Medicare,
long term,
what we did was we said,
I mean, he's trying to help y'all out even when he out of office.
If we're going to deal with our long-term deficits. But to do that, let's look where some of the money is going. $716 billion we were able to save from the Medicare program by no longer overpaying insurance companies, by making sure that we weren't overpaying providers. And using that money, we were actually able to lower prescription drug costs for seniors by an average of $600. And we were also able to make a significant dent in providing them the kind of preventive care that will ultimately save money throughout the system. So the way for us to deal with Medicare in particular is to lower healthcare costs. When it comes to Social Security, as I said, you don't need a major structural change in order to make sure that Social Security is there for the future.
We'll follow up on this. First, Governor Romney, you have 2 minutes on Social Security and entitlements.
Well, Jim, our seniors depend on these programs, and I know anytime we talk about entitlements, people become concerned that something's going to happen that's going to change their life for the worst. And the answer is neither the president nor I are proposing any changes for any current retirees or near retirees, either to Social Security
so why the
or
fuck
Medicare.
bring it up?
So if you're
y'all ain't proposing nothing,
60-year-old,
why bring it up
any further? But for younger people, we need to talk about what changes are going to be occurring. Oh, I just thought about one. And that is, in fact, I was wrong when I said the president isn't proposing any changes for current retirees. In fact, he is on Medicare. On Social Security, he's not. But on Medicare, for current retirees, he's cutting $716 billion from the program. Now he says by not overpaying hospitals and providers, actually just going to them and saying, we're going to reduce the rates you get paid across the board. Everybody's going to get a lower rate. That's not just going after places where there's abuse. That's saying we're cutting the rates. Some 15% of hospitals and nursing homes say they won't take any more Medicare patients under that scenario. We also have 50% of doctors who say they won't take more Medicare patients. We have 4 million people on Medicare Advantage that will lose Medicare Advantage because of those $716 billion in cuts. I can't understand how you can cut Medicare $716 billion for current recipients of Medicare. Now you point out, well, we're putting some back. We're going to give a better prescription program. That's $1 for every 15 you've cut. They're smart enough to know that's not a good trade. I want to take that $716 billion you've cut and put it back into Medicare. By the way, we can include a prescription program if we need to improve it. But the idea of cutting
so he's trying to take the money he's trying to save and help
to be able to balance the additional
put it right back in
is, in my opinion,
how the fuck that gonna help America?
And with regards
you gonna
to
spend the money he just worked so hard to save
to
up.
make sure Medicare and Social Security are there for
and
them
you gotta think
without any
about the
question.
shit he be saying.
First of all, I think it's important for Governor Romney to present
Get him,
this plan that
Obama.
he says
Get that nigga
will only
Obama.
affect folks in the future. And the essence of the plan is that he would turn Medicare into a voucher program. It's called premium support, but it's understood to be a voucher program. His running mate.
And you don't support that?
I don't, and let me explain why.
Again, that's for future
I understand.
people, right? Not for current retirees.
So if you're 54 or 55, you might want to listen, because this will affect you. The idea, which was originally presented by Congressman Ryan, your running mate, is that we would give a voucher to seniors and they could go out in the private marketplace and buy their own health insurance. The problem is that because the voucher wouldn't necessarily keep up with healthcare inflation, it was estimated that this would cost the average senior about $6,000 a year. Now, in fairness,
That's
what
money,
Governor
bro.
Romney has now said is he'll maintain traditional Medicare alongside it. But there's still a problem.
Just on
Because what happens is
insurance.
those insurance
Don't mean
companies
shit
are
happening
pretty
to you. Just
clever
on
at
insurance,
figuring out who are the
6,000
younger
a year.
And healthier seniors. They recruit them, leaving the older,
That's 500 a
sicker
month,
seniors
right?
in
You got
Medicare.
500 a month just to give up?
Every healthcare
don't.
economist who looks at it says over time what will happen is the traditional Medicare system will collapse. And then what you've got
Now, he's
is
talking about your
folks like my
grandma,
grandmother at the
granddad,
mercy
great
of the
aunt.
private insurance system,
500 a month, just give up.
precisely at the time when they are most in need of decent health care. So I don't think vouchers are the right way to go.
Ridiculous.
And this is not my only my opinion. AARP thinks that the savings that we obtained from Medicare bolstered the system, lengthened the Medicare trust fund by 8 years. Benefits were not affected at all. And ironically, if you repeal Obamacare, and I have become fond of this term, Obamacare.
Obamacare.
If you repeal it, what happens is those seniors right away are going to be paying $600 more in prescription care. They're now going to have to be paying copays for basic checkups that can keep them healthier. And the primary beneficiary
Copay,
of
like they pay,
that repeal
and plus they have
are
to pay.
insurance
The seniors
companies
pay along with the go.
that
It's ridiculous.
are estimated to gain billions of dollars back when they aren't making seniors any healthier. And I don't think that's the right approach when it comes to making
So we
sure
gonna
that
spend all
Medicare
this
is
money
stronger
on
in the long
nothing.
term.
We'll
That's
talk
basically what he's
about,
saying. We're
specifically
gonna take this
about
money we
healthcare
saved and spend it on
in a moment.
nothing.
Do you
Ain't gonna help
support the voucher
shit.
system,
Why we gonna
Governor?
spend it?
What I support is no change for current retirees and new retirees to Medicare. And the president supports taking $716 billion out of that program.
What about the voucher?
So that's number one. Number two is for people coming along that are young. What I do to make sure that we can keep Medicare in place for them is to allow them either to choose the current Medicare program or a private plan, their choice. They get to choose, and they'll have at least two plans that will be entirely at no cost to them. So they don't have to pay additional money, no additional $6,000. That's not going to happen. They'll have at least two plans. And by the way, if the government can be as efficient as the private sector and offer premiums that are as low as the private sector, people will be happy to get traditional Medicare, or they'll be able to get a private plan. I know my own view is I'd rather have a private plan. I just as soon not have the government telling me what kind of health care I get. I'd rather be able to have an insurance company. If I don't like them, I can get rid of them and find a different insurance company. But people make their own choice. The other thing we have to do to save Medicare, we have to have.
Why is this nigga talking about his opinions? I want to hear some
But
facts.
for higher income
Fuck your
people,
opinions,
we're
what you
gonna
would
have to
do.
lower some of the benefits.
Fuck you,
We have
nigga.
to make sure
You got
the
money.
program is there
You
for the
running out
long
here
term.
going from
That's the
time to
plan
time,
that I
got
put
people
forward. By the
supporting
way,
you,
the
giving you
FDA
money.
came,
Fuck
not
what
even
you would do
Paul
about some
Ryan,
insurance,
Senator
nigga.
White,
Shut
who's
up.
a co-author of the bill with Paul Ryan in the Senate, but also
Straight up.
came from Bill Clinton's chief of staff. This is an idea that's been around a long time, which is saying, hey, let's see if we can't get competition into the Medicare world so that people can get the choice of different plans at lower cost, better quality, I believe, in competition.
That sounds
Jim,
suspect.
if I can just respond very quickly.
That sounds
First of all,
real suspect.
Every study has shown that Medicare has lower administrative costs than private insurance does, which is why seniors are generally pretty happy with it. And private insurers have to make a profit. Nothing wrong with that. I mean, that's what they do. And so
Everybody want
higher
that
administrative
profit.
costs
Everybody want that dollar.
plus profit
Everybody.
on top of that. And if you were going to save any money through what Governor Romney's proposing, what has to happen is that the money has to come from somewhere.
Somewhere.
And
Listen.
when you move
Listen.
to a voucher system, you are putting seniors at the mercy of those insurance companies.
Mercy.
And over
Swerve.
time, if traditional Medicare has decayed or fallen apart, then they're stuck. And this is the reason why AARP has said that your plan would weaken Medicare substantially. And that's why they were supportive of the approach that we
AARP
took.
said this,
That's
not
one last point I
Obama.
want to make. We do have to lower the cost of healthcare, not just in Medicare and
Talk about
Medicaid,
that in a minute.
but overall.
Oh, okay.
And so
That's a big topic. Can we stay on Medicare?
Yeah, we're going to bring, yeah, I want to get to it, but all I want to do is go very quickly
Let's get back to
before we leave the
Medicare.
economy.
Let's get back to Medicare.
No,
The president said that the government can provide the service at lower cost.
See how every time that nigga be trying to say something, the white person just feels like he had something to say. And the white person actually be quiet and let him say it. But when Obama do it, he cut Obama off. That's ignorant.
Can the two of you agree that the voters have a
Ignorant,
choice,
bro. I don't like this
a clear
shit,
choice
man.
between
Absolutely.
yes or
Racism
you
is
on
still
Medicare?
alive, low key.
All right. So, to finish quickly,
Not through me, but low
briefly,
key.
on the economy, what is your view about the level of federal regulation of the economy right now? Is there too much? And in your case, Mr. President, should there be more? Beginning with you, this is not a new 2-minute segment to start, and we'll go for a few minutes and then we're going to go to healthcare, okay?
Regulation is essential. You can't have a free market work if you don't have regulation. As a business person, I had to have I need to know the regulations. I needed them there. You couldn't have people opening up banks in their garage and making loans. I mean, you have to have regulations so that you can have an economy work. Every free economy has good regulation. At the same time, regulation can become excessive.
Is it excessive now?
In some places, yes. In
Like
other
where?
places,
I mean,
no. It can become out of date. And what's happened with some of the legislation that's been passed during the president's term, you've seen regulation become excessive, and it's hurt the economy. Let me give you an example. Dodd-Frank was passed, and it includes within it a number of provisions that I think has some unintended consequences that are harmful to the economy. One is it designates a number of banks as too big to fail, and they're effectively guaranteed by the federal government. This is the biggest kiss that's been given to New York banks I've ever seen. This is an enormous boon for them. There have been 122 community and small banks have closed since Dodd-Frank. So there's one example. Here's another. In Dodd-Frank, it's...
You want to repeal Dodd-Frank?
Well, I would repeal it and replace it. We're not going to get rid of all regulation. You have to have regulation. And there's some parts of Dodd-Frank that make all the sense in the world. You need transparency. You need to have leverage limits for institutions.
Well, here's a specific.
Let's mention the other one. Let's talk the other big
Well,
one.
let's not.
Okay.
No, let's not. Okay,
To this specific on Dodd-Frank and what the governor just said.
Well, I think this is a great example.
What the governor just said.
The reason we have
Not
been
the
in such
president, the
an
governor.
enormous economic crisis, it was prompted by reckless behavior across the board. Now, it wasn't just on Wall Street. You had loan officers that were given loans and mortgages that really shouldn't have been given because the folks didn't qualify. You had people who were borrowing money to buy a house that they couldn't afford. You had credit agencies that were stamping these as A1 great investments when they weren't. But you also had banks making money hand over fist, churning out products that the bankers themselves didn't even understand
Hand of fish.
in order to make big profits, but knowing that it made the entire system vulnerable. So what did we do? We stepped in and had
Actually did the wrong way. Don't blame me for that. It's hand of fish like this, you know what I mean?
We said
Like,
you got
give me that
banks,
money,
you got to raise your
beat
capital
that
requirements.
ass,
You can't engage in some of this risky
That's what that means if y'all don't know.
Main Street at risk. We're going to make sure that you've got to have a living will, so we can know how you're going to wind things down if you make a bad bet, so we don't have other taxpayer bailouts. In the meantime, by the way, we also made sure that all the help that we provided those banks was paid back every single dime with interest. Now, Governor Romney has said he wants to repeal Dodd-Frank, and I appreciate, and it appears we got some agreement that a marketplace to work has to have some regulation. But in the past, Governor Romney said he just wants to repeal Dodd-Frank, roll it back. And so the question is, does anybody out there think that the big problem we had is that there was too much oversight and regulation of Wall Street? Because if you do, then Governor Romney is your candidate. But that's not what I believe.
That's just not the facts. Look, we have to have regulation in Wall Street.
And what just came out his mouth.
Have regulation,
Then he make it
but I
look
would
bad. This is
designate
not
5
true.
banks as
It's
too
just
big to
not.
fail
Oh, let me say
and give
something
them a blank
else.
check.
Shut up, nigga.
That's one of the unintended consequences of Dodd-Frank. It wasn't thought through properly. We need to get rid of that provision because it's killing regional and small banks. They're getting hurt. Let me mention another regulation of Dodd-Frank. You say we were giving mortgages.
It's not true. Now let me talk about something else.
That's exactly right. It's one of the reasons for the great financial calamity
This
we had.
nigga, bro, you
And
funny,
so
bro.
Dodd-Frank correctly says
Anybody
we
that
need
voting
to
for him,
have
y'all
qualified
funny.
mortgages, and if you give a
Y'all
mortgage that's
just
not
ignorant.
qualified, there are big penalties.
That nigga can't even
Except
search
they
in his
never
own
wanted
mind.
to define what a qualified mortgage was.
Right.
It's been 2 years. We don't know what a qualified mortgage is yet. So banks are reluctant to make loans, mortgages. Try and get a mortgage these days. It's hurt the housing market because Dodd-Frank didn't anticipate putting in place the kinds of regulations you have to have. It's not that Dodd-Frank always was wrong with too much regulation. Sometimes they didn't come out with a clear regulation. I will make sure we don't hurt the functioning of our marketplace and our businesses because I want to bring back housing and get good jobs.
All right, I think we have another clear difference between the two of you. Now let's move to
Straight
healthcare,
up.
where I know there is a clear difference, and that has to do with the Affordable Care Act, Obamacare, and it's a 2-minute new
Obamacare.
segment, and that means 2 minutes each. And you go first, Governor Romney. You wanted repeal. You want the Affordable Care Act repealed. Why?
I sure do. Well, in part, it comes again from my experience. I was in New Hampshire. A woman came to me and she said, look, I can't afford insurance for myself or my son. I met a couple in Appleton, Wisconsin, and they said, we're thinking of dropping our insurance. We can't afford it. And the number of small businesses I've gone to that are saying they're dropping insurance because they can't afford it, the cost of health care is just prohibitive. And we got to deal with cost. And unfortunately, when you look at Obamacare, the Congressional Budget Office has said it will cost $2,500 a year more than traditional insurance. So it's adding to cost. And as a matter of fact, when the president ran for office, he said that by this year he would have brought down the cost of insurance for each family by $2,500 a family. Instead, it's gone up by that amount. So it's expensive. Expensive things hurt families. So that's one reason I don't want it. Second reason, it cuts $716 billion from Medicare to pay for it. I want to put that money back in Medicare for our seniors. Number 3, it puts in place an unelected board.
He just said
that's gonna tell people
he's not worried about the
what kind of treatments
seniors.
they can have.
If anybody
I
was
don't like
listening,
that idea.
we're not worried about you. Turn your TV off.
There was a survey done.
You remember that? I remember
across
that.
the country.
Well, I'm doing that
So
for the
what's been
seniors.
effect of
What?
Obamacare on your hiring plans?
Shut
And
the
3/4
fuck
of them
up.
said it makes us less
He
likely
can't search his
to hire
own
people.
mind. Y'all think I'm just hating. I'm not just hating, nigga. You're
Come
ignorant.
into office.
Why would I
facing
want you as
23
my
million
leader?
people out of work, rising unemployment.
I don't even
an
have no
economic
leader
crisis
personally,
at the
but why would I want
kitchen
y'all
table,
as their leader?
and spend his energy and
America.
passion for 2 years fighting
Can't
for
even search your
Obamacare
own mind, my
instead
dude.
of fighting for jobs for the American people. It has killed jobs.
At the end of the day, they all
And the
puppets,
best
but
course
shit,
for
you a
healthcare
dumb puppet.
is to do what we did in my state. Craft a plan at the state level that fits the needs of the state. And then let's focus on getting the cost down for people rather than raising it with the $2,500 additional premium.
Mr. President, the argument against repeal.
Well, 4 years ago when I was running for office, I was traveling around and having those same conversations that Governor Romney talks about. And it wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall healthcare costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. If they had a pre-existing condition, they might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit.
And it should be looking like
And so as a consequence, they're paying their premiums, somebody gets really sick,
this
lo
nigga.
and behold, they don't have enough money
think you're smart,
to
don't
pay
you,
the bills
nigga?
because the insurance companies
Shut
say
up.
that they've hit
Fake
the limit.
ass smile.
So
I know y'all see his fake
we
ass
did work on
smile.
this alongside working on jobs because this is part of making sure that middle-class families are
Looking
secure
like
in this
Rudolph.
country. And let me tell you exactly what Obamacare did. Number one, if you've got health insurance, it doesn't mean a government takeover. You keep your own insurance, you keep your own doctor, but it does say insurance companies can't jerk you around. They can't impose arbitrary lifetime limits. They have to let you keep your kid on your insurance plan until you're 26 years old. And it also says
26. If you don't know, it's usually 18.
Insurance companies are spending more
Obamacare
on administrative costs and profits than they are on actual care. Number two, if you don't have health insurance, we're essentially setting up a group plan that allows you to benefit from group rates that are typically 18% lower than if you're out there trying to get insurance on the individual market. Now, the last point I'd make before
2 minutes is up, sir.
No, I think I had 5 seconds before you interrupted me. Was
swear.
the irony is that we've seen this model work really well in Massachusetts because
that 5 seconds. Keep
Governor
going, man.
Romney
Keep going.
did a good thing working with Democrats in the state to set up what is essentially the identical model. And as a consequence, people are covered there. It hasn't destroyed jobs. And as a consequence, we now have a system in which we have the opportunity to start bringing down costs as opposed to just leaving millions of people out in the cold.
Your 5 seconds went away a long time ago. All right, Governor, tell the president directly why you think what he just said is wrong about Obama.
Well, I did with my first statement, but I'll go on.
Please elaborate.
I'll elaborate, exactly right. First of all, I like the way we did it in Massachusetts. I like the fact that in my state, we had Republicans and Democrats come together.
Massachusetts.
What you did instead,
if you don't know, that's almost in
a
Canada.
single Republican vote. As a matter of fact, when Massachusetts did something quite extraordinary, elected a Republican senator to stop Obamacare, you pushed it through anyway. So entirely on a partisan basis, instead of bringing America together and having a discussion on this important topic, you pushed through something that you and Nancy Pelosi and Harry Reid thought was the best answer and drove it through. What we did in the legislature, 87% Democrat, we worked together. 200 legislators in my legislature, only 2 voted against the plan by the time we were finished. What were some differences? We didn't raise taxes. You've raised them by $1 trillion under Obamacare. We didn't cut Medicare. Of course, we don't have Medicare.
But he like that word, trillion.
By $716 billion. We didn't put in place a board that can tell people ultimately what treatments they're going to receive.
I'm gonna be $1 trillion rapper.
We didn't also
$1 trillion rapper.
I think a number of people across this country recognize, which is put people in a position.
Bugatti Cardiac.
Insurance.
Call me $1 trillion man.
Right now, the CBO says up to 20 million people will lose their insurance as Obamacare goes into effect next year.
I just want to tell y'all this side note. My rap name Young Cardiac, but I also go by Titan.
Anticipating dropping people from coverage.
Cardiac
so for
the Titan.
Reasons, for the tax, for Medicare, for this board, and for people losing their insurance, this is why the American people don't want Medicare, don't want Obamacare. It's why Republicans said, do not do this. And the Republicans had the plan. They put a plan out. They put out a plan, a bipartisan plan. It was swept aside. I think something this big, this important, has to be done on a bipartisan basis. And we have to have a president who can reach across the aisle and fashion important legislation with the input from both parties.
Governor Romney said this has to be done on a bipartisan basis. This was a bipartisan idea. In fact, it was a Republican idea. And Governor Romney, at the beginning of this debate, wrote and said, what we did in Massachusetts could be a model for the nation. And I agree that the Democratic legislators in Massachusetts might have given some advice
like I said, if you fuck with Mitt Romney,
on how to cooperate.
You're lost.
But the fact of the matter
you
is,
as a person
we
are
use the
lost.
same advisors, and they say it's the same plan. When Governor Romney
if he elected president, man,
unelected board that we've created. What this is
America
is
done with. America over. You know what I mean? They done.
How can we
It's a wrap.
reduce
Straight
the cost
up.
of care in the system
Straight
overall?
up.
Because there are 2 ways of dealing with our healthcare crisis. One is to simply leave a whole bunch of people uninsured and let them fend for themselves. To let businesses figure out how long they can continue to pay premiums until finally they just give up and their workers are no longer getting insured. And that's been the trend line. Or alternatively, we can figure out how do we make the cost of care more effective.
Y'all got insurance at y'all job?
So
I don't.
At Cleveland Clinic, one of the best healthcare systems in the world, they actually provide great care cheaper than average. And the reason they do is because they do some smart things. They say if a patient's coming in, let's get all the doctors together at once, do one test instead of having the patient run around with 10 tests. Let's make sure that we're providing preventive care, so we're catching the onset of something like diabetes. Let's pay providers on the basis of performance as opposed to on the basis of how many procedures they've engaged in. Now, so what this board does is basically identifies best practices and says, let's use.
That's smart, cause y'all know these people just be raping y'all, boy. Hospital bills, boy, they be through that. And y'all not even doing that much. Like, what the fuck? But the hospital bills be stupid, boy.
Obamacare is fully implemented. We're going to be in a position to show that costs are going down. And over the last 2 years, healthcare premiums have gone up. It's true, but they've gone up slower than any time in the last 50 years. So we're already beginning to see progress. In the meantime, folks out there with insurance, you're already getting a rebate. Let me make one last point. Governor Romney says we should replace it. I'm just going to repeal it, but we can replace it with something. But the problem is he hasn't described what exactly we'd replace it with, other than saying we're going to leave it to the states.
That nigga blink more than anybody I know.
But the fact of the matter is that
anybody.
Some of the prescriptions that he's offered, like letting you buy insurance across state lines, there's no indication that that somehow is going to help somebody who's got a pre-existing condition be able to finally buy insurance. In fact, it's estimated that by repealing Obamacare, you're looking at 50 million people losing health insurance at a time when it's vitally important.
Let's let the governor explain what you would do if Obamacare.
You know when people blink a lot, I'm gonna say to a fact. I know this is a fact. If a person blinks a lot, I mean they have lapses of memory. Their memory is not that good. If a person can hold their eyes open, whoever can hold their eyes open the longest has the best memory.
For that to occur. But let's come back to something the president and I agree on, which is the key task we have in healthcare is to get the cost down so it's more affordable for families. And then he has as a model for doing that a board of people at the government, an unelected board, appointed board, who are going to decide what kind of treatment you ought to have. In my opinion, the government is not effective in bringing down the cost of almost anything. As a matter of fact, free people and free enterprises trying to find ways to do things better are able to be more effective in bringing down the cost than the government will ever be. Your example at the Cleveland Clinic is my case in point, along with several others I could describe. This is the private market. These are enterprises competing with each other, learning how to do better and better jobs. I used to consult to businesses, to hospitals and to healthcare providers. I was astonished at the creativity and innovation that exists in the American people. In order to bring the cost of healthcare down, we don't need to have a board of 15 people telling us what kinds of treatments we should have. We instead need to put insurance plans, providers, hospitals, doctors on target such that they have an incentive, as you say, performance pay for doing an excellent job for keeping costs down, and that's happening. Intermountain Healthcare does it superbly well. Mayo Clinic is doing it.
If we're going to take back, man,
Cleveland Clinic
still ain't blink yet.
The right answer
is
not to have the federal government take over healthcare and start mandating to the providers across America, telling a patient and a doctor what kind of treatment they can have. That's the wrong way to go. The private market and individual responsibility always work best.
Let me just point out, first of all, this board that we're talking about can't make decisions about what treatments are given. That's explicitly prohibited in the law. But let's go back to what Governor Romney indicated, that
that nigga just shut his shit down, prohibited in the law. He feels so stupid.
Governor, that isn't what your plan does. What your plan does is to duplicate what's already the law. Which
Obama won it. Sometime I'm gonna start talking, y'all, man. Y'all go out there and press that button and vote for Obama in November.
Getting continuous coverage.
Hey, just like DJ Drama said, check out that dedication for you know what I mean.
If you've
And I've been waiting, you know what I mean? I'm pretty much done with my mixtape, but I've been waiting to drop it. So y'all go peep out Galaxy. I'm gonna let y'all know about it, all about it. And I just hope y'all go out there, download that, and support the kid, you know what I mean? Because if it was something you wanted to do and it was a dream you wanted to live and you were actually good at it, I would support you.
But what it does say is
real talk. Real niggas say real shit at real time.
That also means that you got more customers.
Go Obama, man. That's my dude. It's Cardiac Titan signing out.
But can't
I can't get my work straight signing out.
In fact, replaced,
and I'm done.
The reason he set up the system,
Romney
he did in Massachusetts, because there isn't a better way of dealing with pre-existing conditions.